So, how exactly do you know if you need estrogen? Well, I think the big problem right now is that we're only looking at the upside of hormone and hormone replacement therapy, and we're not considering if there's still any risks involved with doing this. And I think part of it is a lack of kind of agreement on what kind of testing should be done and what to be looking for to be completely aware of how our hormones are being used by the body, being made in the body, being metabolized in the body. So, specifically with estrogen, I think that there still should be some concerns around whether or not we do this without enough information and enough data as we navigate this time in our lives. And I mean, this is important for me too. I'm in this chapter in my life. And so I think that, and I'm always really passionate about people having the right information so they can make good choices. I mean, it really is just about how you want to navigate this for yourself. And how can we do that if we don't have the right information, if we don't have the right choices? So, I think one of the things that's super interesting is if you Google how to test your hormones in order to treat them, you're going to find that diagnostic testing blood work comes up as being, the favorite way to test. And yes, blood work is used for practitioners that have prescriptive authority to make that decision with regard to prescriptions. But again, kind of looking at it in a little bit of a broader picture, if you were to Google what's the best way of showing hormones that are bioavailable, or what's the best hormone testing, or what's a good way of looking at your hormones, you're going to see that saliva testing, even if you put in like, is saliva better than blood? If you leave out the prescriptive or hormone replacement therapy, you're going to find that a lot of studies say that looking at hormones through saliva is actually a better way of looking at your hormones because you're looking at what's bioavailable to the body. So, really, my opinion is why don't we have both? Look, why aren't we looking at how our blood transports hormones throughout our body? And then why aren't we looking at what is bioavailable to the body in the cell, in the way that we're metabolizing hormones, we're using hormones, and they are moving throughout the body differently. If anyone follows me or has been to any of my talks, you know that I like to use a lot of analogies. So one of the things that helped me kind of get my brain around this, because it's like, I don't, you know, hormones in blood, hormones in saliva. The way that I kind of think about it is mining for coal and coal miners in the old fashioned way that coal used to be put in these uh, train carts to be moved to a place where they could be used. So imagine that where your body manufactures hormones is the mine, and that your blood is like the coal miner and it's extracting the hormones so that it can transport them into the cell, and that's measured by saliva. And that is in that cart, which is going to move to the rest of your body to be used by your body. Again, what's bioavailable to your body and the way it's being transported. Both are really measuring two different ways that your body is moving hormones. And so we don't test as often in saliva as we would necessarily in blood, but having a baseline so that you know, because look, estrogen is metabolized, synthesized in the gut and the liver. So with digestive issues, which are very common with age, and with things like elevated cholesterol or fatty liver from sugar consumption. Look, people that have things like high fasting insulin, elevated liver enzymes, or elevated cholesterol, or these things should be considering that in relationship to how their hormones are being effectively metabolized in the body, again, specifically estrogen. So sometimes when we do both tests, we see a match. Blood transport and saliva cellular bioavailability looks the same, and other times one is super low, one is super high, and then other times it's the opposite. Sometimes what we see is kind of a hidden estrogen dominance in the cell, in the saliva, and they've been getting prescriptive estrogen maybe for a while now, and they don't really feel, they might feel okay, but they also might be having symptoms that aren't really related to what is known as estrogen dominance. But look, if anybody has followed me with histamines, you're going to know there's this histamine loop that we can get stuck in with this um, there's an estrogen loop that we can get stuck in with the histamine loop. Basically, the more histamines our body makes, we can be more vulnerable to making more estrogen, or even messing with estrogen receptors as these mast cells become activated, and we're interfering with digestion, with stress response. And the stress response, we don't often think about our adrenals as hormones. We're just thinking testosterone, progesterone, estrogen, when in fact cortisol, DHEA, those are hormones, they're made in the adrenals. And that's another thing, is that when we're looking at hormones, we need to think about, have we gotten all the information we need? Have we gathered all the information? And retesting is super important too. I think this is another thing where women don't understand. They're just told sometimes, well, this is the age you're in, or the phase that you're in. So you're just going to need this because it's really good for your heart, your brain, your bones. And well, estrogen has been studied and shown to be really important to these things. What is most important is that we're doing hormones safely. And I think that the way that we need to take charge of our own health and kind of move through this misinformation that winds up happening around this is to think about whether or not we have enough information about how our body is using, storing, metabolizing our hormones, specifically estrogen. However, that helps you think about that, maybe, and there are some practitioners that are only using saliva testing. And then again, some are only using blood. And really, I'm going to challenge listeners, if you're a practitioner provider, to think differently about maybe how you gather information, even on a baseline, and just look, especially as women move into this menopausal, postmenopausal state of life. We're using our hormones differently than when we had this menstrual cycle. And also, too, it's just really important to start to think about metabolizing these hormones, and to start thinking about how much inflammation is in the body, specifically in the mitochondrial, that might be affecting the way your mast cells are reacting, which might start to interfere in the way that you're handling estrogen or messing with your estrogen receptors. Again, those that have gut issues, gut inflammation, liver might need to really consider looking at how they're metabolizing their estrogen as a really safe way of navigating their menopausal years. So, do you know what your gut is really doing? Do you know what your hormones are really, how they're really being used in the body? If you don't do kind of a fact-finding, data gathering bit of information to challenge yourself and go, yeah, this is, I'm on this. I love it. Um, and my labs say that I'm using it really well. Because I think what we're going to find, and it may not happen for another 10 years, I think we're going to start to maybe consider that, just that estrogen may become a problem again. Remember, historically it was like, oh no, contains risks. And then we went from that to, oh, this is so important for us. What if the data really helps us navigate those who could be at risk? Um, Look, those that have something called COMT, it stands for catechol-methyltransferase, that's a genomic marker that for some increases their risk of metabolizing and processing estrogen correctly. Sometimes they could be super deficient. Sometimes they could be more vulnerable to estrogen dominance. Sometimes it could change depending on how their body's responding to stress, which can affect progesterone levels. So, this is also kind of something to think about too, is looking at your whole body when you're in a phase of life where you're trying to consider whether or not you should support your hormones or not. And I mean, this is something I'm always passionate about is the education, the resources. How can we think about this? How can we gather enough information so that we're navigating this correctly? One of the most fascinating studies that I came across over 10 years ago was looking at how underdeveloped countries went through this change of life without really being symptomatic. And that's fascinating to me. And I think what's also missing from the hormonal conversation is those hormone disrupting foods and how we're going to have a hard time really kind of stabilizing our hormones. They're a moving target. This is also why maybe even looking at more frequent blood work could be in your best interest, because if you're constantly doing these hormone disrupting foods like alcohol, caffeine, refined sugar, cow dairy, these things sometimes can make you more vulnerable again to not metabolizing or synthesizing as optimally as you could be. And so, are you chasing something? I mean, as the price of prescriptions climbs, this is something that, maybe you want to think about is, am I chasing something? Also, maybe teasing out. I think we assume right from the get-go for having a hot flash, it's got to be from low hormones. And when in reality, some people could be having that hot flash from estrogen dominance. They could be having a hot flash because they're going into a histamine flare. And so this also kind of makes sense if you think about that research that was done with women in underdeveloped countries. They're they're very likely going to be less vulnerable to a histamine issue. And so that means that, are we even thinking about this in the whole conversation with estrogen? Looking at, again, our stress response with cortisol, our progesterone, and how that's affected by stress. And also then that cortisol, histamine, messing with estrogen receptors, what does that mean for our health and the empowerment to hormones? And what does that look like in terms of feeling really good about the prescriptions you take? Do you have enough education around that? Or if you're doing herbs in conjunction, there's some herbs that are adaptogenic and can help round out and boost hormones, or other supplements that can help that metabolism of estrogen. And so, that's a consideration too, is how are you responding to hormone replacement therapy? And does that need to be supplemented nutritionally, either with dietary considerations or with nutritional food herbal supplements? Again, I think that if we can start to have a different conversation, I talk about this as like a better menopause. I think women deserve to have more information about what their body is doing individualistically. And if you consider that digestion and stress are going to greatly impact the way you metabolize your hormones, and that is going to impact your decision on what you do to help support your hormones. And are you relying too much on something that you're not rounding out with diet or something else? So that's something, look, sleep is so important to us. And that is, again, night sweats, waking up, urinating in the middle of the night. We start to think that this is, if we're having any kind of urinary incontinence, oh, this must be from low estrogen. But if you expand the conversation even bigger and to start think about, yeah, okay, part in part, we're going to lose estrogen, progesterone, testosterone as we age, but our symptoms, how much of our symptoms are tied to this, and how much of it is actually in more control if we're going to manage diet a little bit differently and have an expanded conversation around how our hormones could be affecting our health and how our diet and nutrition is going to be affecting our hormones. So I'm going to encourage all of you to think differently about hormones, estrogen. How do I know if I need estrogen? Well, I think if you start to think about, do you have enough data to help you answer that question? Then that might help you kind of feel more comfortable and confident stepping forward in either, again, managing it nutritionally with adaptogenic herbs, with prescription, or a combination of that so that you feel like you're in this next chapter of your life really healthy and vibrant, and that you're not risking anything just to get out of symptoms. All right. Food for thought. It was great visiting with you today. I hope to see you again soon.